Good morning. Welcome to Open at School. This part of Neurology Simplified. Today I will be giving an introduction to neurological history taking the method. Neurological diseases are common. Approximately 1 billion people suffer from neurological problems worldwide. An approach to neurological disease should be systematic. Otherwise, it will be considered as one of the most difficult part of clinical examination. So, I will briefly outline how will you look at a patient with a neurological problem. There are mainly 3 questions to be answered. First question is, has the patient got a disease? Has he got a genuine neuro problem? Second question, where is the problem? Third is, what is the problem? And the second question should be answered prior to answering the third question. I will explain this. A patient with a fractured neck of femur may come with complaints of weakness. But actually it's not a neurological problem. Many conversion reactions. Many times it is difficult to identify whether it is a genuine neuro problem or not. That will explain the first question. And once you know that is a pure neurological problem or a true neurological problem, anatomically localize. So anatomy is the second most important thing. And only after localizing the problem, you try to identify what means the etiology. Now we'll just think, how will you identify the localization? The localization is by the symptomatology. So symptoms localizes. For example, a patient complaining of weakness of one side of the body, that is hemiplegia, is having involvement of the motor system, that is the pyramidal tract, anywhere starting from the cortex up to the muscle. So we are localized anatomically into the pyramidal tract or a motor system. Then you try to identify in which part of the pyramidal tract, whether it is in the cortex, internal capsule, brainstem. So in the central nervous system, so you identify it as a peripheral nervous system problem versus central nervous system. If it is in the central nervous system, try to identify later where is it. That is again the difference part of the central nervous system. So this is what is meant by localization. So first thing, identify whether there is a neurological problem. Second, try to localize into central nervous system versus peripheral nervous system. Then you try to identify in which part of this central or peripheral nervous system. So this explains the anatomical localization. Next, you think about the pathology or the etiology of the disease. How will you identify the temporal progression? Time will give the answer. For example, somebody complaining of weakness of one side of body of sudden onset, that is, by doing something he developed weakness of one side of the body, that is sudden onset. It is always vascular. But suppose the symptom has evolved over 1 month, gradually progressive, it is likely to be a space occupying lesion. If weakness is of several months or several years duration, unlikely to be a growth, it may be something which is a degenerative pathology. So this is a simple example to differentiate the pathology. Same symptomatology can be due to different pathology. So this is identified by the temporal progression of the disease. One more point I would like to explain to you regarding symptomatology. When the patient is giving the history, clarify whether what you say and what the patient mean by the same symptom is the same one and the same. For example, somebody complaining of vertigo, it's a very common symptom. Actually, the patient may be meaning an imbalance, or it may be feeling of rotation, or even sometimes loss of consciousness, they will say as vertigo. So, confirm with the patient what do you mean by the symptom. So, pay attention to the patient's description of symptoms. Be aware that the same words may mean different for different people. You hope this point you understood. Then always try to get a history from the relatives. Corroboration of the history. Additional information should be obtained from family, friends, or even from previous doctors who have treated the patient. Many of the neurological diseases have got some familial or inherited. So always get a family history. Family history is very important. And again, remember, most of the neurological problems are secondary to a medical illness, like diabetes mellitus, hypertension, or some infections. So a proper medical history, again, very important. History of medications. The may be due to the side effect of a drug. For example, hyponatremia. Patient may coming with a drowsiness or seizure may be due to hyponatremia. Drugs and toxins. Proper history of drugs and toxins should be taken. And when you you see the patient itself, from the behavior, the language and mood of the patient, you may come to some impressions. So try to make some initial impressions on seeing the patient. So in conclusion, history is very important. You have to spend a lot of time for history. Try to define the anatomy. Try to identify the pathology by taking the temporal progression of the disease. Always confirm what the patient says and what you understand are the same. And next, think about the medical illnesses the patient is having, like diabetes, hypertension, tuberculosis. I also mentioned about the importance of family, the medications, and drugs and toxin exposure. The next session will be discussing about the examination.